And we all want and need the government to succeed in defeating coronavirus. But we also have to have the courage to challenge where we think the government is getting it wrong. And in that spirit, I want to start with testing. Testing is obviously crucial at every stage of the pandemic. But we have been very slow, and we're way behind other European countries. Now, the Health Secretary made a very important commitment to 100,000 tests a day by the end of April. But yesterday, the figure for actual tests was 18,000 a day, and that was down from Monday, which was 19,000 tests a day. So we're way behind the curve, and the end of the month is a week tomorrow. So what does the First Secretary expect to happen in the next 8 days to get us from 18,000 tests a day to 100,000 tests a day?
Rightly raises the crucial issue of testing, which is going to be an incredibly important part of our strategy for transitioning from the current social distancing measures. But I do have to just correct him. Our capacity for tests is now at 40,000 per day. So I think that is an incredibly important milestone. And of course, he's right to say that in the final week, that will require a big increase. But of course, with a project like this, it does require an exponential increase in the final days and the final week of the programme. I can reassure him that we are working with a range of commercial partners to boost the testing to get to that 100,000 tests per day. 2 of our super labs in Milton Keynes and Alderley Park are now fully functional, and Glasgow will be open later this week.
Keir Starmer.
Thank you very much to the First Secretary, and thank you for his kind comments. I didn't need correcting because I gave the figure for the actual tests a day. The First Secretary says that there's capacity for 40,000 tests a day, and I think it's really important that we fully understand what the First Secretary just said, because that means that the day before yesterday, 40,000 tests could have been carried out, but only 18,000 tests were actually carried out. Now, all week, I've heard from the front line, from care workers who are frankly desperate for tests for their residents and for themselves, desperate. They would expect every test to be used every day for those that need them. So there's clearly a problem. Why isn't the government using all the tests available every day?
Well, Secretary.
I thank the right honourable gentleman, and it's important to pay tribute because there are 2 elements of this. Getting the capacity up is part of it, and we're making good progress, and I hope that he has conceded that point. The issue of then increasing the demand is something that we've got control over. Of course, we're making sure that the eligibility is broadened. Our focus, as I think he would agree, should be on frontline NHS staff, broadened out to care workers and other key workers, and then done in a way which the system can manage. We are confident that based on our test capacity that we will be able to deliver that, and we have in relation to the capacity itself and getting to the 100,000 target, a range of deals with Thermo Fisher, with Randox. We've got the AstraZeneca, GSK and Cambridge University working together to set up a new lab that we will deliver, and those tests will be crucial, not just in terms of controlling the virus, but allowing the country to move to the next phase.